everyone, I'm Vanshika Makol, pursuing my Masters at IISc Bangalore. We have with us today Dr. Siddharth Jhunjhunwala, Associate Professor at Department of Bioengineering, IISc Bangalore. A very warm welcome to you, sir. Welcome to Treat DM 2025. Shall we begin with the interview now?
Yes, thank you very much.
Sure. So the first question I would like to ask would be, moving from laboratory models to clinical application is always challenging. What are the main hurdles that you face in translating your biomarker innovations into real-world diabetic foot care?
It's a fantastic question and difficult to answer in short. But I'm going to try to give some pointers and then we can elaborate as required. The challenge usually is that what we see in animal models replicate only certain features of the clinical problem. And exact replications of the clinical problem in laboratory or animal models does not exist. So there are features that we just are not able to answer using these models, and there are some that we're able to answer. And the ones that we're not able to answer usually become the impediment for translation. The second one that's a problem is actually figuring out all the requirements for cleaning up and sterilizing and understanding the scale-up procedures, which when you go into clinical trials, that we never focus on in the scientific aspects. Yeah. So that's a major hurdle, I feel, the first and the second one. But I think there have been some good examples of clinical translation that have occurred out of IISc and out of other places in India, of course, abroad too, that we are learning from and figuring out what we should actually test in the animal models and laboratory models, and what we should aim for when we start translating, and what should be the science that we do, because the translational science is different from our laboratory science. So I'll stop there.
That was truly intriguing. Thank you so much. Moving forward, from your perspective, what needs to change in current clinical protocols to better integrate regenerative and immunomodulatory approaches into diabetic wound management?
It's a difficult question to answer for me because I'm not a clinical practitioner. So my answer is based on my academic experience. Clinicians may disagree with this, but let me state what I think is happening. I think in the clinic, our core, what I've seen, my colleagues who were collaborators who I work with, their core focus is to ensure that the patient feels comfortable and there's particular type of treatment that is well established, well recognized, and there's nothing new being tried, which is exactly how it should be. But what happens in that case is some of the newer technologies don't get incorporated fast enough. They may be approved. And so I'm not talking about unapproved under trial technologies, but they may be approved in certain cases, but they're not necessarily tested enough in the clinical setting in that particular doctor's clinic. And so there's hesitation of trying these new things. So maybe once things get approved and go through all the regulatory tests and approvals, then a faster utilization of some of those newer techniques in the clinic would be very useful.
Sure.
How you do that is not clear yet.
Okay. So since we are here, how effective do you think conferences like Treat DM are in fostering a collaborative approach to advance healthcare and research?
Absolutely essential. I feel that unless we have these sort of conferences where clinicians, scientists, translational scientists, and industry experts come together, hear each other out, we are never going to understand each other's domain expertise and problems that we face. So, for example, a scientist could be doing very good research in their laboratory, but some of it may not be applicable in the clinic, at least in the way they're doing it. And so they may need to change some of the things based on the type of problems and questions the clinicians see with the patients. So that conversation gets started in places like Treat DM, and newer collaborations emerge, which is crucial for translating science into the clinic. So I would say this sort of conference is essential.
Great to hear that. Lastly, what advice would you offer to young scientists and clinicians who aim to bridge between fundamental discoveries and practical therapies in metabolic disease research?
I hope I'm young too, but for younger researchers, I would say that the one thing that I have learned is to sit down and ask your clinical collaborator, or the other way around, for the clinician to ask the scientific collaborator, what issues do they face? How can you help them solve their issues? Rather than coming with, I have this idea, I'm going to pursue this, how can you help me with that idea? That's a good way. Usually it works very well in science, but if you want translation, if you want clinical application, I think sitting with a clinician and asking what their problem is a better approach to having that translation.
That was great advice. Thank you, sir, for your precious time and valuable insights. It was pleasure having you at Treat DM 2025.
Absolutely my pleasure. Thank you.